Hi, it's Paul Harris here, and in the studio today, I've got two special guests who are going to tell us all about arthritis, because October is Arthritis Month. It's Raj and Mohana from Relive Physiotherapy in Chester.
Hi, Paul. This is Raj. I'm the lead physiotherapist here from Relive Physiotherapy in Chester.
Hi, Paul. This is Mohana. I'm a lead physiotherapist from Relive Physiotherapy, Chester.
We both are the founders of Relive Physiotherapy. It's all started from our office room. And one day we decided, okay, let's go out to help more people in the community while we were working in the hospital. And that's how we formed our practice in Chester.
Excellent. And so whereabouts in Chester do we find you?
It's right in the middle of the city. Don't panic, people, if they wanted to come and see us. We have plenty of ample car parking space. The best way to come to us is through the city road, and you will find on the other side of the train station, you'll find the Premier Inn, and next to the Premier Inn, there is an Indian restaurant called Coconut Grove Restaurant. Drive through the restaurant, you'll see the barrier, press the buzzer, one of our team members will let you in. Come up to the ramp, car park, and walk through the office room, and here we are. We'll be grateful to invite you there.
Sorry, Mohana, with a cup of coffee. Yeah, lovely. So do people need a referral from anyone, or can they just get in touch and come straight in?
So the answer is no. So we don't need any referral from any doctors or any healthcare practitioners. We are totally an independent, autonomous practice who practices musculoskeletal condition, i.e. any problem from joints, muscles, ligaments, cartilage, and any etc., any soft tissue problems, what we can deal with. And we are treating almost 200 to 300 people every week, in and out. So most people come and go, get treated, and get the happy outcome, and they go back to their life, what they want to do.
So when people come to you, do they have an assigned physio, or do they see different physios at different occasions?
We are all master degree holders in physiotherapy, ranging from musculoskeletal to physiotherapy to sports physiotherapy. So we're all having expertise ranging from 4 years to 25 years, which is me. So we have a bunch of expertise there. So based on the expertise and based on the clinical needs, our front desk team will have the capacity to listen to all the problems what people are explaining on the phone or on the email when they are contacting us first thing. And based on that, the person will have the appropriate physiotherapist to be chosen. In doubt, we have an option that where physiotherapists can contact the person straight away and speaking to the people and then put the right action in place, who's the right person, i.e. some physios we do acupuncture, some physios we do injection therapy, and most people will do hands-on mobilization and right supporting exercises, plan of care where the problem is not treated only for that particular time, and also they can be getting better and stable for a lengthy period of time. We are the team which we help people in treating the root cause of the problem rather than treating the symptoms, i.e. not just the pain, where the pain comes from, whether the muscular problem is originating from this local area or different areas, treat that cause and then get them back into their way of life.
Right. And if you're someone who isn't able to come into your practice, say you're housebound for whatever reasons, do you have an outreach service at all?
Unfortunately, we can't go out to people, and we used to have that, but it's because of time and factoring in and a lot of commitments, because when people are more housebound, there may be a little bit of a social care involved. So at the moment, we are putting on hold, but that will be our next project once we are stable, when we'll have a separate team working on that.
Right, that's good. So let's talk about what you're in here for today, which is about your community event. What's it about? When is it? And where is it?
Oh, thank you, Paul. We love the community events, and we are not new to those community events. So the next one, what we are trying to do is, in light of the Arthritis Month, which is October, so we decided to run an education event for people who are suffering with arthritis. Having said that, it's not only for people who are suffering with arthritis, also people who wants to know about arthritis, or friends or family may be having some arthritis problem, and they may want to know upfront what it is and how it is going to affect or what they can do to avoid any form of symptoms. So having run this kind of events in the past and having been very successful, so we thought we'd keep it going this year as well. So we are doing it on the Saturday, which is more easy for a lot of people, working or non-working people or senior people. They can come and meet us on the Saturday, the 2nd of November at 10 a.m. at Relive Physiotherapy in Chester. By the way, the car parking is absolutely on site.
Right.
With a cup of coffee and biscuit.
It's always helpful, isn't it? So, I mean, I've often heard when you have arthritis, there's not much you can do about it. Is this true?
Very interesting you asked that. So that is very common mythical question. And people were told that there's not much we can do, rest and take some painkillers and that will settle down. It is not always the case. So it is individual based. And I'm going to say, not necessarily everybody has to be suffering with what they are suffering with. So based on their clinical demands, and if we have that clear evaluation what the person problem is, understanding the cause of the problem, and we put an action plan in place as simple as self-management activities, and this could change the person's life enormously. They don't have to be suffering with the rest of their life with a lot of discomfort, stiffness and restriction, can't play with the grandchildren or can't bend down to do things and can't lift that activity because of the fear of arthritis may get worse. And the simplest self-management type of actions they can put in place on a regular basis and they can just get the best result out of it. So the answer is no.
Okay. What can a person with arthritis do to help relieve their pain? You've just said a number of things there. Is there something they can do as well? Would you give them, for instance, a set of exercises to do or nutrition advice, that kind of thing?
As I said, we do offer the bespoke service. So every person with individual arthritis is different from the other person. Like one size doesn't fit all.
Yep.
So we need to understand what the problems the person is going through. Whether some people may be suffering with a lot of pain. Whereas some people may be having a lot of restriction in their function. The joints may not be moving and the joints has lost its mobility. And some people may have the sincere problem of muscle weakness. So if the muscle weakness is the issue, so then we can understand where the muscle groups are originating and what the prime function of the muscle groups, and understanding the function of the muscle groups, putting some home-based, simplest activities for them to say, okay, these are the exercises you go and try, come back to see us again. And then I'll put you on the next challenging exercises, stage by stage, what the person can handle it right from the stage. And this could help them to motivate themselves. Okay, I'm seeing some benefit of it. I walked five minutes and now I can walk 15 minutes. And then the next time they come back, I can walk 30 minutes and I can walk for a mile. So that's the progress you can see on a daily basis. Yes.
Yeah. What's the difference between osteoarthritis and rheumatoid arthritis?
Very good question. So the widely known arthritis is the osteoarthritis. We also call that as normal changes related to the joints. So anybody and everybody will have some signs and symptoms of arthritis. So that is osteoarthritis. So it is a very common arthritis. At least 70 to 80% of the world population will have some form of arthritis in their life. Whereas the other form of arthritis is rheumatoid arthritis. So by the way, there are more than 200 types of arthritis. So very common knowns are osteoarthritis and rheumatoid arthritis. So rheumatoid arthritis is entirely a different ballgame. So it is called as an inflammatory arthritis, whereas our own immune system acting against our body, and that is when it causes a lot of bodily inflammation. The way how the bodily inflammation exposes themselves is through some of the joints, and that's what is rheumatoid arthritis.
Right.
In those kind of situations, can physiotherapy be more useful? Of course, yes. More specifically, there will be an involvement of the doctors to help them with some certain specific inflammatory medication. Alongside with that, physiotherapy backup will be really, really helpful for them to thrive through. Whereas the osteoarthritis is a very common arthritis, and where people are told rest and take pain medications, there's nothing else can be done. That is not correct. Identifying what the problems are with the person, whether the person problem is the restriction, or whether the person problem is the pain, or whether the person problem is not able to do. If we can identify the root cause of the problem and put some action in place, which can be a course of hands-on physiotherapy. Person with pain problem, they come to us, Within 2 or 3 sessions, they say pain is starting to get better. And then the person with the muscular imbalance problem with some certain specific exercises and specific training, what they can go through stage by stage, bespoke, and they say, definitely I'm able to do the task what I can't do.
Right. And in terms of the treatment of people on any kind of injections, is that something you can provide, or do they need to get a GP prescription, or what's the situation?
Very good question, Paul. So we are living in 2024. So a lot of physiotherapists can do the injections nowadays. And at Relive Physiotherapy, and for that matter, in Cheshire area and in the Wirral areas, there are only a handful of physiotherapists who can prescribe and inject at the same time. For our clients, they don't have to go anywhere else. They can come in to see us on the day and get that prescribed. They are having the specific type of injection. They can have it done on the same day itself.
Wow.
So there are 2 types of injection therapy we offer. One is the cortisone injection, also known as steroid injection. And the other one is the hyaluronic acid supplement injection, which is also known as a lubrication injection, the cartilage lubrication injection. If you want to know the difference in those two, steroid injections are widely used for pain relief. It is an anti-inflammatory drug. It is useful for pain relief, gives them quick pain relief, and get them to do the task what they like to do and go back to their exercises and correct the work by the time when the steroid wears off and the problem is fixed and they are having more happy days.
Right.
Whereas the second form of injection is getting much more popular because it is not a drug. It is the hyaluronic acid creams and facial creams nowadays because it's the major composition of the cartilage in our body system. I call this as the lubrication injection, and is also adverse free effect because it is not a drug. And because it's not a drug and it is very popular and it doesn't have any contraindications to how many times you have. So one injection can last up to even 12 months time.
Yep.
And it's not a drug. It lubricates the cartilage, adds a little bit of another lining of the cartilage, which allow the people to be able to do the function what they were not able to do before and get their function back. And they are going to go back to their sporting activities. They are going to go back to their activities, what they want to do, walking, gardening, and people who have difficulty with climbing stairs up and down, they went back to doing things. And people who have had about 50% of flexibility, they went up to 90% of the flexibility and they improved their function within a few weeks' time.
Wow.
Yeah.
That's quite impressive then. Yeah. So there's a lot of information about arthritis on the internet, and it makes you really difficult to know what to believe, doesn't it? So why should people listen to you?
Absolutely. So I treat thousands and thousands of people with arthritis, and we have helped a lot of people in these circumstances. Yes, I was told that is the only way going forward. And we defied them by having a proper hands-on physiotherapy, putting on through their structured home-based exercises based on their clinical needs and clinical demands. Now, being a chartered physiotherapist, we always follow the evidence-based guidelines to help people with those kind of difficulties. And our goal is to get them back to their function as quicker as possible. So we are the experts, and we have been rated as the expert physiotherapist in local area in Cheshire and the Wirral. And good evidence is you can see what people are talking about us on the website and on Google. We have more than 420 plus 5-star Google reviews.
Yes.
For instance, one person who came to us and told us I've been 40 years been suffering with this arthritis, and I have given up. But a friend of mine has said, I just wanted to come to see you what you could do or for anything. So as soon as we saw her on the first session itself, we did a detailed evaluation, put a clear status, what we are going to achieve, and in 2 months' time, what we're going to see, and in 3 months' time, what we're going to see. By the end of 3 months' time, she started to walk about 30, 45 minutes, where she was not even able to walk for 5 minutes at the time.
Wow.
And then she had the hyaluronic injection. Now she's walking about 3 hours a day.
Well, that's a hell of an improvement,
Yes.
isn't it?
So,
Yeah.
with the 40 years, she has lived with that theory of nothing else can be done, with little can be done, and she was waiting to have a knee joint replacement. So she's now not a candidate for a joint surgery.
Right. Wow. So how do people find you on the social media and internet?
Well, you can find us in all the social pages. So we have a website called reallyphysiotherapy.co.uk, or punch in Best Physiotherapy in Chester. We will be coming up.
Right.
And we are showing our faces on our Facebook page at Relive Physiotherapy. If you're an Instagram user, you can see us at Relive Physiotherapy. You can see us at YouTube at Relive Physiotherapy, and a TikTok at Relive Physio. So these are all the different various forms we keep in communication with people, because we have a very fantastic centralized diary system. So all the social medias are pulled in through one forum, and our front desk can't miss any communication from any of the social medias.
So let's come back to your event on the 2nd of November, the Saturday. So I turn up at 10 o'clock, and what's it looking like, the couple of hours ahead of me, or is it a half day? What's the sort of length and duration?
The program is for 90 minutes.
Yep.
So when people walk in, and they'll be greeted, and direct signposted around the practice, what we have, and meet all member of staff in our practice. And then obviously they're going to be sitting down with a cup of coffee and biscuits of their likes. And then what happens is we are going to do some introduction about the arthritis. And the next immediate thing, what we're going to do is we're going to share any interesting stories and FAQs, what people do, how. And that's the first part of it. Having answered FAQs and a little bit of an education about arthritis, what they can do, what they don't have to do, and what can they do to significantly reduce their symptoms, i.e. pain or stiffness, and how physiotherapy can help them to scale that outcome quickly. And we are going to be showing some of the techniques and the exercises where they can take home and practice themselves and make themselves more better.
Excellent.
So this is a major program, what we have planned. And we'll finish up with further questioning and answer. For questioning and answer, we are available for 24/7, so they can shoot us the question anytime.
Yeah. I'm very aware that physiotherapy is in high demand, and often there are waiting lists. Does this apply to your services?
Absolutely not. We don't want anybody waiting for us. And so we will be getting to see people within 24 hours to 48 hours to the maximum. We work long hours as well. So we start from 8:30 to 7:30 on the weekdays, and we work on Saturdays, 8 o'clock to 2:30 p.m.
That's very good access indeed. Is there anything I've not asked you that you'd like to tell me about?
Well, what I would say, when people are coming to meet us on this event, please do welcome. And you can bring your friends and families if they have any sign of arthritis or anything they want to know about arthritis, or people you may have come across, your friends that said, you know what, my doctor said, take rest. It's my age. Nothing else can be done. I'm going to say no. We have people in their 90s and we have people in their 80s playing 18 holes of golf. I'm going to just say age is not a factor to be limited with for arthritis. If we know what the cause of the problem, and we can fix that problem. So when you come to meet us on the event, and you will get a toolkit and you will get a confidence what can be done to end this problem, what you are suffering with, so that you can go back to play what the sports you want to play. You can go back to the lovely activities, what you like to do, your walking or gardening or spending time with the grandchildren, and even the athletes. They may be just getting more frustrated and they end up giving up their running activities or sporting activities. They don't have to.
That's good news. That's good news. Well, I certainly know where to go if I should have any problems with arthritis, but I wish you every success with the event. Keep us in touch with anything else that's going on at the centre in the future.
Paul, thank you so much. And we can't thank you enough. I suppose that we will be coming back for our next event.
No problem, Raj. And thank you, Mohana.
Thank you so much, Paul. Thank
Okay.
you. It's a lovely experience for us.
We'll stay in touch. Bye for now.
Thank you.